Hi, my name is Grant Duvall, and I'm an orthopedic surgeon at GBMC, employed with GBMC Health Partners. So I've had many family and friends treated at GBMC over the years, actually, and they've always had really good experiences. I think GBMC is very unique in the fact that it's a community hospital, so it provides a really good patient experience while also providing, access to world-class care. I always knew I wanted to do something with my hands when dealing with tasks or projects assigned to me. I think the field of orthopedics in particular gives a surgeon a chance to really positively impact the patient's life in a relatively short amount of time, which can be very gratifying as a surgeon. I love getting people back to doing what they love. So I see patients for hip and knee pain. Usually it's typically hip and knee arthritis. And for those patients, we usually try to maximize non-invasive care, so things like injections or medicines we can give them or certain therapies we can prescribe. If they do need surgery, I do specialize in knee and hip replacements, both primary hip and knee replacements and revision hip and knee replacements. Within that field, I specialize in direct anterior hip replacements and robotic knee replacements. So we use robotics for performing knee surgery. That being said, there's good short and medium-term data that shows that robotics can help with a patient's postoperative pain and do a more minimally invasive surgery, as well as decreasing a patient's stay after surgery. It also helps you more accurately place the components, so we can try to, match the patient's need of anatomy. So after they get a knee replacement, it actually feels more like their natural knee than more traditional methods. So I really do get fulfilled when I see a patient come to my clinic, for evaluation if they have either hip or knee arthritis or some other injury, and it really prevents them from doing something they want to do. Working with them, seeing what their goals are, and then prescribing whatever treatment it may be, whether invasive or non-invasive, like therapy, medications, or injections. Seeing them back in the clinic doing the things they want to do is really gratifying. So the thing that keeps me coming back every day, I love meeting people, I love hearing their stories, I like helping them in the problems that they're dealing with, but I also find it very interesting to learn about their backgrounds, what led them to get to here, where they're from. So I really like getting to know the patient, not just in terms of what pathology they're having, but in terms of who they are as a person.